Mother whose first instinct is to protect her children take this kind of measure? What's going through her mind?
I think it's very difficult to comment on that because obviously we wouldn't have all the details in regards to her specific circumstances. But what we can talk to is the structural violence that is busy ravaging a lot of our communities, and the fact that that has a psychological impact on people. I think the biggest thing is that when you are victim to gross structural violence, and there seems to be almost no intent to change that for the majority of our population, then you're going to end up with a situation where people are living in inhumane conditions. And if that continues, then the humanity really does come out. I mean, this is a really desperate situation where a mother basically can't anymore and is completely overwhelmed. And also on top of that, we know that mental health care facilities and services are very low in those types of areas. So there's no access to care, or, medication runs out and nobody resupplies those areas, and you have all sorts of difficulties.
And there's also that kind of thinking that, and speaking generally here, where there's that perception perhaps to kill them in order to save them, because the amount of the socioeconomic situation is just so heavy on this family that they can no longer afford to survive, that someone might think that this is the more merciful option, and that kind of thinking. So how do we then intervene in that kind of instance?
I think one of the most dangerous things is that when we sit on the outside, the sort of perceived outside, we sometimes see this as an area of interest, when in actual fact this is dire to all of us. I mean, our own spirit and our own humanity is being attacked when people are living in circumstances such this. And I think, because of structural violence, the onus is on us, especially those who are not in that situation, to provide help. And often we're silent in these kind of conversations. The privileged people are silent. And, we'll often say things like, we'll leave it to the politicians to sort it out. Or this is an example of politics going wrong. And I'm not saying it's not, but what I am saying is, I think we all have a duty in order to address these needs. I mean, in Cape Town as well, with the flooding that took place, the social inequality was so there for view that certain people saw it as an opportunity of showing how much water was in their gardens. And for other people, their roofs were taken off, and it was 2 weeks of communities coming together with very little assistance to repair and bring dignity to our brothers and sisters. And maybe that's part of the problem as well, is that sometimes when, you're in a different socioeconomic level in such a socially unequal society such as South Africa, that we forget to see our brothers and sisters. We almost are invisible to our brothers and sisters. We might not even call them our brothers and sisters. And yet this plight is so vital. I mean, this really talks about the spirit of South Africa and the spirit of our humanity.
And it's also, as you say, that when we come from that standpoint of privilege, that it's so easy to say, why didn't you seek help? And then, what is actually available to a family like that in terms of the psychological help and even the economic help? What is actually available to these kinds of families? And talking then about that, do we have a situation where psychology or seeking psychological help or any kind of therapy is considered a privilege in itself, that's something that I don't need to worry about now, I need to get food on the table?
Yeah, unfortunately, and that talks about the social inequality. It shouldn't be a privilege, but it becomes a privilege. And the reason for that is because of the fact that we're so understaffed when it comes to public sector mental health services. And the ones that are working in there are often literally putting on a plaster because there's such an overwhelming need and such understaffing of professionals in those areas. So the answer is no, it shouldn't be a privilege. Mental health is vital for any type of healthcare. If mental health also doesn't just sit in the healthcare business, but it also sits in the humanitarian business. And if mental health is neglected, humanity is neglected. But the problem is because the majority of care ends up being in the private sector, because of Department of Health's not bringing enough money in and finances in to hire the amount of specialists that we need. I think that, if I'm not mistaken, it's as low as 0.1 psychologists per 100 people in South Africa, and that's completely ridiculous and nowhere close to WHO standards. And as long as we're in that situation and that problem, I mean, a country it's only less than 30 years survived the atrocities of apartheid, you would expect that mental health would be high on the agenda. And unfortunately, our situation is that it's not. And so it becomes privileged. And that's just a really poor reflection. But we are living in a democracy. The people's voice is the most important. And I think it's about people able to exercise their voice and say enough's enough. We want a country where we can survive. We want a country where we can live, all of us. That becomes the answer.
Daniel Hollander, thank you so much for joining us this afternoon. He's a clinical psychologist working in Athlone. If you need any assistance, you can contact Daniel on Instagram, on his profile. That's at Those Who Can Struggle. We were speaking to him about this particular case in the Eastern Cape where a mother had taken her own life and that of her 3 children. Her 4th child, the eldest, managed to escape that situation. But it does point to how intensely poverty is being felt in various communities across the country, and some people feeling that is the only option, is to rather die than to live in that kind of situation, in that kind of poor situation. And Daniel saying that, of course, is not the case, and we need to take up that responsibility as well of taking care of those who are less fortunate. The recent strong winds, of course,